Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take a few moments to discuss with you the common condition called urinary incontinence. In this video, I will describe how the bladder and the urethra work. I will define urinary incontinence. I will give you the common causes of incontinence, and then I will briefly discuss some of the treatment options. Now, how does the bladder and urethra work? The bladder and the urethra are almost like a balloon. The stem of the balloon represents the urethra, and the body of the balloon represents the bladder. In order for the bladder to empty of its contents, the urine inside, the bladder has to squeeze, and the muscle of the urethra has to relax. At that time, then fluid can easily exit the bladder. Urinary incontinence is defined as the involuntary loss of urine. Urinary incontinence is extraordinarily common. Over 12 million Americans suffer from urinary incontinence, and it also is a problem associated with aging, as it is more common in men and women over the age of 50. Approximately 1 in 3 men or women over the age of 60 has a problem of incontinence. 8.5 million people who have this problem do not seek treatment. Most people with urinary incontinence can be successfully treated, and many can be cured. Now let's look at the causes of urinary incontinence. It's associated with aging, illnesses, and injuries within the pelvis or to the pelvic organs. Age is associated with incontinence because there are physical changes resulting from pregnancy, childbirth, and menopause that can cause urinary incontinence in women. Men over the age of 50 have a higher risk of developing prostate disease, either benign enlargement of the prostate or prostate cancer. And urinary tract obstruction, difficulty with urination, and urinary incontinence commonly occurs with these prostate conditions. Illnesses such as removal of the prostate gland following surgery can result in incontinence. Infections and bladder irritants and other diseases such as diabetes are frequently associated with urinary incontinence. Also, injuries to the back, to the bladder, or to the nerves from the back to the bladder can result in urinary incontinence. I want to mention that there are various bladder irritants, that is, foods or fluids that can irritate the bladder and make going to the bathroom a bigger problem because of the frequency of urination and urgency of urination. Examples of these foods or fluids are citrus fruits and juices, caffeine, spicy food, and alcohol. There are 3 types of urinary incontinence. One of the most common is stress incontinence, followed by a second variety of urge incontinence, and the third is a mixed combination of stress and urge incontinence. Stress incontinence is the involuntary loss of urine with coughing, sneezing, exercising, bending over. Any kind of exercise that increases the pressure on the bladder can result in the loss of small volumes of urine. Urge incontinence, or overactive bladder, is the urgent need to urinate and the inability to control it. When a person has a problem of urge incontinence, they have the desire to urinate, and they must reach a restroom or toilet within a few seconds before they will empty their bladder and lose large volumes of urine. Urge incontinence occurs when there are more voidings than 8 times per day, or getting up more than 2 times during the night. Mixed incontinence is a combination of both stress incontinence and urge incontinence. Now, how is incontinence diagnosed? It requires a careful medical history, a physical exam, a few screening tests such as a urinalysis, and a urologic evaluation. The screening tests are a voiding diary, a urinalysis to look underneath the microscope for any evidence of infection or blood in the urine, and then blood tests to check for diabetes and a calcium test to check for high levels of calcium within the blood. The urologic evaluation may include a look into the bladder with a lighted tube and a measurement of your bladder pressure called a urodynamic study. The treatment of urinary incontinence begins with various behavior techniques. That is bladder retraining or pelvic muscle exercises called Kegel exercises. The advantages of behavior therapy is it's inexpensive and it's useful for mild stress incontinence. Drug therapy is useful for the treatment of urge incontinence, and there are a number of medications that can relax the bladder, and also topical estrogen is also helpful in the postmenopausal lady who has a decrease in estrogen to the vaginal tissue. The advantages of drug therapy is it's simple to use, it's relatively inexpensive, and it's most effective for the treatment of urge incontinence or overactive bladder. The side effects of drug therapy include dry mouth, constipation, and blurred vision. If you take these medications or other medications such as medications for glaucoma, talk to your doctor about the possible risks of drug interactions. Now there are also mechanical devices such as a pessary, which can be inserted into the vagina that will help control loss of urine due to the problem of stress incontinence. Surgery is also a treatment option, especially for the problem of stress incontinence that doesn't respond to the conservative methods such as the Kegel exercises. A surgical procedure returns the bladder and the urethra to its normal anatomical position. There are three types of surgery. There is an open surgical procedure where an incision is made in the lower abdomen, and then there are needle procedures that are called minimally invasive procedures, and finally there is the tension-free vaginal sling, which is a procedure that takes about 15 minutes, done in the outpatient setting, and the person is completely dry after the insertion of the sling. The advantages of the tension-free vaginal tape or the mid-urethral sling is that it is effective for treating stress incontinence and mixed incontinence, where the major component is stress incontinence with loss of urine with coughing, sneezing, and exercise. The procedure is very short, requires about 20 minutes, and the results are immediate. Most women require no pain medication after the procedure, and it enjoys an 85% success rate. In summary, urinary incontinence is not a normal part of the aging process. It is usually a symptom of something else. The evaluation of urinary incontinence is easily accomplished in the outpatient setting in the doctor's office. Treatment options include medications, exercise, and surgery can all help to restore bladder control. I hope you have found this video useful and helpful. I know you may have some additional questions, and if you would go to my website, www.neilbaum.com, or you're welcome to contact me at my office at area code 504-891-8454. Thank you.